This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to discuss oral ketamine therapy for depression, mood disorders, and pain. And this is at-home ketamine therapy treatment. So how does ketamine work? Well, the simple version is basically ketamine increases neuroplasticity. It increases connectivity within the brain in areas of the brain that have been damaged and lost connections between synapses. Now, synapses are basically where one neuron meets another neuron, and neurotransmitters are crossed between those junctions to basically transmit information. And in the process of depression and mood disorders, there is a loss of neuroplasticity. So effectively, what ketamine results in is increased neuroplasticity with a repair of the underlying neural circuitry that's been damaged by depression, mood disorders, medical illnesses, and many other things. And this ultimately results in improved regulation of glutamate balance in the brain. And glutamate is a primary neurotransmitter in the cerebral cortex involved with learning and pain regulation. And glutamate effectively is what sculpts the tone of serotonin and dopamine, the molecules of happiness and reward and motivation. So glutamate balance is really critical to functioning in other emotional states. So this is effectively what happens with neuroplasticity is the formation of a synapse in an area where the synapse has been damaged, and you can see basically connections forming between separate neurons. So as far as ketamine treatment is concerned, the best method of maintaining and establishing mood and depression treatment is with ketamine infusions. Ketamine infusions are the most rapid method of treatment to achieve remission and response in depression and mood disorders. So effectively, 6 to 8 infusions up to 3 times per week in 40-minute intervals of infusion therapy between doses of 0.5 milligrams to 1 milligram per kilogram administered over that series of infusions results in approximately 60 to 70% of patients having either significant improvement or even remission in their depression. And of course, this would require maintenance infusions, usually monthly, to maintain that effectiveness. As well as in between those particular infusions, the use of at-home ketamine therapy using oral or intranasal ketamine can certainly be used to maintain that neuroplasticity and connectivity. In the meantime, the individual has to, of course, employ lifestyle changes and include psychotherapy as well to effectively maintain the connectivity that they've created with these series of ketamine infusions. So effectively, what we need to do is find out how can we treat ourselves at home, how can we potentially bypass IV ketamine infusions. And there are a number of different at-home therapies available. We'll start with ketamine troches. And so troches are waxy or hard candies that are basically made in compounding pharmacies. And of course, they're made by hand, so this does pose the problems of consistency. So sometimes the troches will have slightly more or less medication inside of them, and some of the medication may be inconsistently distributed within the troche itself. But effectively, the consistency of this is kind of a waxy formulation, much like a butterscotch candy. Of course, this tastes nothing like candy. Ketamine's got a very distinctive bad taste. But effectively, a lot of online ketamine treatment centers offer ketamine in the form of a journey as opposed to a treatment. And so a lot of these online ketamine centers that don't actually meet with their patients directly will offer ketamine in the form of journeys, as if the journey itself is where all the healing takes place. But effectively, what we showed earlier is that the neuroplasticity is really where the treatment occurs, and this use of the journey as the actual healing process is really just kind of stolen from serotonergic type of drugs such as psilocybin and MDMA, which effectively use the serotonin system of the brain in the form of their increasing neuroplasticity, whereas ketamine is using the glutamate system, which is a primarily dysregulated system in many cases of depression. Now, there is no association of better outcomes with dissociation in ketamine use. So you don't have to actually have a journey, and you don't have to have disembodiment or lose control in order to make ketamine work for you. After all, what you're really looking for is repair your neural networks, rebalancing of the glutamate system, and increased neuroplasticity. Now, one benefit of using at-home ketamine troches as an example, or at-home ketamine oral therapies, is that you can maintain your effectiveness from your ketamine infusions in between maintenance infusions. So if after your 6 to 8 initial infusions you get remission or significant improvement in your depression, you can actually go on these at-home oral ketamine troches to maintain that effectiveness, so you don't have that kind of falling off of the cliff feeling that you might get before your next infusion. And generally those follow-up infusions are monthly. Some people can push them off even more wider apart over time. Now, generally speaking, most people will use these ketamine troches 3 times a week. But however, some will have to need to use them as many times as 7 days a week. Generally speaking, this is based on clinical efficacy and outcomes. But the general idea is to at least have 1 or 2 days off per week. And as far as dosing, the doses are variable, and we generally will titrate these doses to clinical outcomes as opposed to the journey. So if an individual uses ketamine on any regular basis, they'll start to notice that they don't feel that trippiness over a longer period of time. And again, they still get the neuroplasticity, but the trippiness part may diminish and may be more variable. The same thing is seen with other types of psychedelic substances. And again, ketamine is a dissociative agent, not technically a psychedelic, but with other psychedelics like mushrooms, you take them every day, you eventually don't have much of a journey. But that said, the whole bottom line here is all about neuroplasticity and repair of neural networks. So we mentioned that the doses are variable, and you definitely want to titrate these types of doses to clinical outcomes, which is generally based on the person's mood and their functionality. So as various examples, again, studies that are out there are all over the place with the dosings that are used, but some cases people will take low dose ketamine every day as LDKs, which is approximately 30 milligrams of ketamine once a day in the morning to kind of start the day off. However, generally speaking, in Nova Health, a lot of our patients will end up on 100 milligrams 2 or 3 times per week initially of oral ketamine, just as a maintenance program for their depression treatment after IV ketamine therapy. Now, there are centers that will offer super high doses. A lot of these are just online ketamine centers or online ketamine forums that will effectively offer extremely high dosing that could be several hundred milligrams to even a gram and above. However, most people would be very uncomfortable using something like that if they haven't had prior experience with ketamine, and it seems like it's a little bit excessive, and certainly the consistency of those doses in a troche would be certainly hard to keep consistent. So overall, I think 100 to 200 milligram troches are sufficient for the majority of people if it's appropriately compounded. And so generally speaking, when we start somebody on at-home ketamine therapy, how much would you need to use, and how do you use this ketamine treatment? Well, generally with ketamine troches, you'll place them between your gum and cheek, and you'll hold it there for approximately 10 minutes. Now, some people place it below their tongue, and the veins will absorb the majority of this. Now, 20% of the ketamine is absorbed. So if you get a 100 milligram troche, then approximately 20% of that will be absorbed over that 10-minute period of time. Now, the question is, should you swallow it or spit it out afterwards? And a lot of people will swallow it to obtain that second journey, but there is a slight increase in nausea and abdominal cramping as a result of that. So spitting out is certainly appropriate as well. And of course, always expect the bad taste. And the other important thing is you're going to use this at home in a safe space. Certainly, you can monitor your blood pressure as well. Ketamine can increase transiently blood pressure during the time that you're using it. And the other note is that if you're microdosing something like ketamine, you generally shouldn't feel anything at all, because microdosing refers to basically a subclinical threshold, non-palpable feeling after you use the substance itself. So microdosing refers to taking a dose at such a low amount that there isn't any trippiness, there's no psycholytic effect. So just to remember that if you're microdosing ketamine, then you want to choose the dose that effectively gives you good clinical outcomes, but doesn't give you any type of journey. And so for some people that could be 20 milligram troches or 50 milligram troches, and for others it could be a lot higher, but everybody absorbs this differently. So just to let you know, there are some studies on the use of oral ketamine in mood disorders and chronic suicidality. And the bottom line is that it takes longer for oral ketamine to work, up to 2 weeks in some cases, or even several weeks. And it's less likely to produce remission, but it certainly can give relief from depression. So it's unlikely to produce remission, whereas IV ketamine is very much more likely to produce remission and also give relief as well, and also more rapidly. Now, for chronic suicidality, there have been studies that have shown daily use of oral ketamine over several weeks seems to decrease the sense of chronic suicidality. And we've already mentioned about the dosing ranges, anywhere from 20 milligrams all the way up to a gram or more in some cases are used. But we generally recommend at our center between the 100 to 200 milligram dosing. And usually that's supplied about 2 to 3 times per week. You could sort of emulate a infusion cycle by just doing 3 days per week on alternate days like Monday, Wednesday, Friday. And that's a certain way of maintaining efficacy after infusions. But you could certainly start a person at home ketamine therapy to give them relief and hopefully remission, and or even augment their underlying antidepressant therapy by starting them off with at home ketamine therapy, because it certainly is a lot cheaper than the IV infusions, but it is certainly slower and ultimately less effective. Now, for pain management with oral troches, you would generally use these probably pretty much daily, depending on the type of pain. And again, there's a wide variety of pain issues that people may have that they may use this for. But some people will use troches several times per day. And for others, they'll use troches as a abortant type treatment for migraines or cluster headaches, just to kind of prevent a headache from starting on, or when a headache is already there, they can actually treat the headache using the oral ketamine, usually in combination with an at-home intranasal ketamine spray, which we offer at Nova Health. Now, when you do these at-home ketamine therapies, certainly don't do it too close to bedtime, because it does tend to be a little bit activating and may keep you up at night. Now, then there's also ketamine RDTs, ready to dissolve tablets, the rapid dissolving tablets that are kind of, again, similar to troches in terms of the dosing and kind of what we described to how you use them, but these are more explosive in nature. So you basically put them under your tongue and they kind of just pop open and release this powder. And it seems to absorb even better than the troches, but certainly the taste is the same, not very good. And the dosing ranges are certainly very similar, but some people find these to be even more effective than the troches. Then we have ketamine kind of sustained release capsules, where we use this for primarily pain management, where basically racemic ketamine, that's RNS ketamine, is put in an oral formulation. The person swallows the pill and kind of releases ketamine slowly over a period of time. And this primarily is helpful in pain management. Then we have ketamine dots, which are a combination of ketamine at approximately 30 milligrams with midazolam, which is Versed. It's a benzodiazepine at about 2 to 3 milligrams, and that dosing can be variable, as well as ondansetron, which is a anti-nausea medication. This is really helpful for decreasing panic attacks, people with acute panic, those that suffer with high levels of anxiety. This can provide ataraxia, which is kind of a wakefulness but restful, peaceful mind. It kind of shuts down the thoughts and all the looping inside the head that sometimes occurs when people are really anxious. And it's certainly helpful in insomnia, because it can certainly allow an individual to fall asleep and still get a ketamine dose. But again, it is a very good option for those that have trouble sleeping when they use ketamine therapy, especially towards the evening. Now, this is something you wouldn't use necessarily every day, because over time you would begin to be tolerant to the midazolam itself. So, effectively, oral ketamine therapy for home use provides relief of depression, anxiety, pain, and multiple other mood disorders, and it is less likely to provide remission. However, it certainly can provide relief, and that could take a little bit longer than infusions. But again, relief is certainly very helpful when you're depressed or feeling sad. Also, this can augment traditional antidepressant therapies. And it may certainly take a few weeks to reach effectiveness, but on the other hand, though, for some people, this is the most cost-effective method is to start with oral ketamine therapies. However, if you start with oral ketamine therapies, you can certainly come and do a couple of IV therapies to kind of maximize your results. And there's no right or wrong way to do that. Certainly, we have people that start off with the at-home therapy for their depression, and then maybe a month or two later come in when they can afford one or two infusions. And that seems to really work well for a lot of individuals. Now, remember, this has to be used in conjunction with continuing psychotherapy. Ketamine therapy can certainly lubricate psychotherapy, and it can also augment traditional medication treatments. So you certainly want to continue your traditional medication support, and also, of course, include lifestyle changes, whether it's eating, sleeping, and exercise. All those things are important. And the main side effects are nausea and stomach cramps. Dosing of ketamine is titrated to clinical results. Basically, when we follow up patients in the office, we make certain that we check their various scoring systems for anxiety and depression and have conversations to maximize the person's outcomes and their dosing of at-home oral ketamine therapy. Now, again, everybody absorbs oral medication differently than others, and so that's what makes this tricky, is because with IV dosing we get 100% bioavailability, but with oral ketamine only 20% is available. And the treatment ways that we will offer this in the dosing schedule could be from daily to several times per week, or other variations in timing and dosing. There are really no clear clinical trials showing the best dosing strategy or timing of oral treatments. But again, we always recommend not using ketamine directly before bedtime. And of course, you cannot drive after using home-based ketamine for about 4 to 6 hours. Now, the last thing is, unlike psilocybin and other serotonergic type treatments or psychedelics in which the journey seems to have a correlation to results and outcomes, this hasn't been shown with ketamine. So ketamine is a glutamate-based system, and it really relies on neuroplasticity and repair of broken neural networks. It repairs those neural networks, but it doesn't create new neural networks. So it doesn't, for example, change your personality. And that said, it only can work with the broken networks themselves. It does increase synapses and synapse formation. That results in that neuroplasticity. And so effectively with ketamine, there is no definitive association of outcomes with dissociation. So you don't have to lose control with this particular treatment.